for taking time out of their busy schedule for joining us, and let's begin the training covering the application submission and underwriting for the MedSup life insurance offered by Transamerica Premier. I'd like to introduce our featured speaker, Dave Lurch. Dave is manager of the Transamerica Medicare Supplement underwriting team, and he has over 30 years experience working with this product. He's an amazing resource when it comes to Medicare Supplement. So without further ado, Dave, take it away, please.
Okay, hello everybody. Thanks, Kristen. We'll go ahead and get started here with our presentation today. Really, how to people new to MedSup, it's a totally different product than what you're likely used to selling. Some of you may have experience with that, but there's a couple of key resources or resource areas that you can reference to learn a whole lot about this Medicare Supplement product. The first one is Medicare and You. It's at medicare.gov, the Guide to Health Insurance for People with Medicare, and our Transamerica Admin Underwriting Guideline. We've got probably about a 30 or 35-page guideline that outlines really everything you need to know to write, and also contains a lot of our rules that we have. And it just provides guidance through the application, and we've got a long list of medications in there that I'll get to that have a lot of other rules, and just to help walk you through the application and understand the different pieces of the Medicare and writing Medicare Supplement policies. Okay, Kristen, next slide. So who is eligible for a Medicare supplement? In order to have a Medicare supplement, you've got to have Medicare Parts A and B at the time your coverage starts. So typically, people can sign up for Medicare Part A and B at age 65 or when you retire. The Medicare Part A and B are the hospital and doctor portions. They pay for the hospital and doctor portions. There's also a Medicare Part C that I'll just mention because we'll go through more on that when we get to the application. That's called Medicare Advantage, which is kind of it's kind of a competitor of MedSup. Medicare Advantage, it's like an HMO where you're restricted to certain hospitals, doctors, and so on and so forth. We don't sell that. We sell the Medicare supplement. And there's also a Medicare Part D, which is a prescription drug portion of Medicare. So you can sign up and get a Medicare supplement and also a Part D to help pay prescription drugs. So so you must be a resident of the state for which you're going to apply for coverage. And you must be age 65 or older to get the policy, because that's when you can get the Medicare. Some people that are under age 65 with disabilities are eligible, and we'll go through some of those rules as we go through the application. Transamerica, strong with life and annuities, senior market focus. It's a great addition to our life insurance portfolio. So keep that in mind, as you may have a list of clients that you know are of this age right now that you may want to contact. Currently, there's about 53 million individuals enrolled in Medicare. That number is expected to grow by about 3% each year. The current estimate for overall 2014 MedSup sales is between 3.5. Let me see, I've got to try to, let me close a window here. No, I don't want to do that. I can't see the whole slide here, Kristen, for some reason. But anyway, new premium sales between 3.5 and I'm not sure what that says. And
it's 3.6 billion.
Oh, 3.6 billion, or 25
yep.
Total billion is the total premium. So it's a huge market. CSG Actuarial expects that over 10 companies will have supplemental sales greater than 50 million in 2015. One of the big things to mention probably at this point is the market. Okay, and you go out and you look at industry stats, you go out and look at just the general aging of the population, and the estimates are that 10,000 people turn age 65 every day. So the market is enormous, and it kind of refreshes every day because there's that many more people turning age 65. So, okay, next slide. The open enrollment. There's really three different pieces to a Medicare supplement. Open enrollment is the first one. Everybody gets an open enrollment when you turn age 65 and you're going to enter Medicare. You have, once you get parts A and B, you have 6 months to apply for coverage for a Medicare supplement and not answer any health health questions at all. So everybody on this phone, everybody that turns age 65 has a 6-month free pass to get a Medicare supplement. So that is sometimes also called to age 65 business. To write that business, we have, and many of our key competitors throughout the industry, because there's a mad scramble to get the age 65 business, we also accept applications as early as age 64 and a half. So if you have clients that are turning age 65, you're talking to them, you're writing coverage for them, we can take an app as early as age 64 and a half to be effective on the date when they turn age 65. So it's important to note here, and it's outlined in our administrative guide, say your birthday is August 25th. You are actually eligible for Medicare on August 1st, okay? If your birthday is August 1st, you're actually eligible to get the Medicare July 1st, okay? So it's always, if your birthday is during the month, you're eligible on the 1st of that month. If your birthday is on the 1st of the month, you're eligible on the 1st of the previous month. So keep that in mind as you go through this. But two important keys: you have to have Medicare Part A and B in order to get a Medicare supplement, and our effective date will line up with the effective date of your Medicare Part A and B on the age 65 business. One exception to that, and this gets a little complicated, and you'll get familiar with it as we go. But just say, for example, you decide you're not going to retire at age 65. You're going to work to age 67. Okay, you still have, once you sign up for Medicare Part B, you still have 6 months that you can apply for coverage and not have to answer any health questions. And that's assuming that you're coming off your group coverage or coverage elsewhere. If you miss the 6-month window, so just for example, you forget about, somebody forgets about it, whatever, you only get one pass at 6 months from your Part B eligibility date. So if you don't apply for coverage during that first 6 months, then you've got to answer health questions, okay? Okay, so guaranteed issue guidelines. Guaranteed issues, there's also guaranteed issue rules that apply in different states. Some of the states that we have, that Kristen mentioned earlier, Missouri is called a policy anniversary state. Missouri, that rule says that, you know, once you have a Medicare supplement, and each year on the policy anniversary of that policy, you can switch to any other carrier that sells Medicare supplement in Missouri. If they have a lower premium, you can switch on the policy anniversary of every year if you want. There's several what we call birthday states, and those are California, Oregon, which means on your birthday, if you have a Medicare supplement and you're unhappy with the coverage or the premium goes up or whatever, somebody comes out with a lower premium, you can switch to any other carrier on your birthday, within 30 days of your birthday, every year if you want. Now, some of those situations in the guaranteed issue get a little bit, we have a few other requirements. For example, in Missouri, we require proof of the anniversary date because we don't want to just issue people that are guaranteed issue a policy unless they're eligible for it. So you have to provide proof of the anniversary. You have to provide proof of the plan that they have. And we have 4 plans. We have A, F, G, and N. And you have to provide proof that that other coverage is currently paid up in Missouri. In California, Oregon, same thing, except they're birthday states. So in California, Oregon, we just need proof of the previous plan, and we need proof of the paid to date. reason we're asking for proof of plan and paid to date, number one, is we want to make sure the policy is enforced, because if it's lapsed, then you have to go through underwriting. The reason we ask for the proof of the plan is those rules also state, and all this is outlined in our admin guide, that you have to switch. You can't go from a lower plan to a higher plan, increase coverage. You've got to move plan to plan. Okay, so keep that in mind if you're writing business in those states. And again, all that's laid out in our admin guide. Okay, next slide, Kristen. Okay, for underwritten policies, typically we're going to see underwritten policies in these situations. Number one, somebody forgets about their open enrollment period, and we see it every day that people forget to get their health insurance or their Medicare supplement, and they apply for coverage, but they missed their open enrollment period of 6 months. So that seems like a long time. You think, how could somebody forget about that and get coverage without having to answer any health questions? But it happens every day. So we typically see the underwritten cases would be cases that people forget about their open enrollment, or if somebody has, say, a policy from Aetna or Blue Cross Blue Shield or Cigna, some other company, and they want to move to our company. Maybe we have a better rate on the plan, and we could save them $20, $30 a month, and that's big-time money for people that are retired on fixed incomes. So those are the cases that we typically see. To do the underwriting, it's a simplified process, and the application is simplified as well. But the underwriting piece of it, we check MIB, we check prescription drug, and we'll do a phone interview. Right now, we're doing random phone interviews. There is talk internally of us moving to 100% PHI, and not sure exactly the timing on that, but by the time we get started, you guys start selling here at the end of the month, it'll be kind of a random process, and then we'll see where we go from there. So our PHIs are done by an external vendor. They're done by EMSI, and they get pretty quick turnaround for us. To give you a time frame on how long it takes to get a policy start to finish, if the application comes in, all the questions are answered correctly, we have all the information we need, we'll get the PHI ordered. It's possible to have, if we get the app on Monday, it's possible to have the decision for you on Friday, maybe stretch into Monday, Tuesday, and the next week, depending on if EMSI can get a hold of the applicant to do the phone interview. So some of that's timing. You guys know how that works. You know, if the vendor calls and they're not available, they do try to call on the, and we do have a question on the application, what's the best time to call for the phone interview? Please try to get that information correct, because that's the time the vendor will try to call them. So trying to think of other points there. I think that's it there. So how we're unique from the industry. We are a little bit unique, and we've done this strategically to try to get the best rates possible for our products. Before I get into this, when I talk about rates, it's a very, very standard process and practice in the MedSup industry for companies to re-rate their policies on an annual basis. They call that trend rating. So each year, well, let me step back before I say that. All of our MedSup policies are issued with a 12-month rate guarantee. Okay, that's pretty much standard for the industry as well. Thereafter, premiums can remain the same. They might go up slightly. They call that trend rate increases. The trend rate increases account for increases in costs from doctors, hospitals, physicians, etc. So they call that those trend rate increases. Those all have to be filed and approved with each state before they're allowed before you can implement them. We try to keep the trend rate increases in the lower single digits. You know, I have seen competitors come out with very high rates or trend rate increases, and that spurs the movement of policies from one company to another. So anyway, how are we different in our underwriting approach? than what is done in the market is for diabetics. We focused on diabetics first off. Our underwriting focus is on control and stability. We do not accept insulin-dependent diabetics. So if they've ever been on insulin, they won't qualify for our product. We do, however, we do take diet and oral medication controlled diabetics, and we will ask, the one exception to our random PHI process today is if you're a diabetic, and that requires a phone interview, because we're going to ask what their last A1C was. If they don't have their A1C, we'll ask for a blood sugar reading or their fasting or random blood sugar readings. We have parameters set around that, but our A1C level is 8. So that's very generous. I mean, if you know people that are diabetics, most people check their doctor checks their A1C on a very regular basis, so they're able to tell us that information. Also, most people are checking their blood sugar, so we can get that either on a fasting or random basis. But the cutoff is 8, okay, and that's a very generous A1C reading for those of you that know things about the A1C. Most physicians like that, you know, in the 5s or certainly right around 6. So there's some leeway there, but we're focusing on keeping the uncontrolled diabetics out of our block of business in order to help keep our rates down. Must fit within our diabetic weight on our build chart. Our build chart is it's in our admin guide, but to the right-hand side of our height weight chart, you're going to see a diabetic build chart. So if you have a client that has diabetes, they must fit within that diabetic weight chart if they have diabetes. Let me give you an example. At 6 foot, our standard weight chart is very generous. At 6 foot, we go from a low of 118 to a high of 304. If you have diabetes, it's 6 foot 229. So they'd have to be below 229 or below to get the coverage. So we are a little bit tighter. Very generous height build chart, but on the diabetics, we ratchet that down some. Blood pressure readings. Our max blood pressure reading, if you have diabetes, is 148/85. We will be asking, we do ask that question on our PHI as well, and people that have high blood pressure generally can tell us their last blood pressure reading. We also have a rule that if you've had your medication increased to control either of those conditions in the last 2 years, we can't issue you now, but we can reconsider you after your medication's been stable for 2 years. One of the reasons we do that is you'd notice back on the previous slide that we routinely don't get APSs. We may get 3 or 4 APSs a month, and that's on cases that we just can't figure out quite what's going on. So we really try to take the MIB, the prescription drug, and the PHI information and go ahead and make a decision without APSs. So, and again, any use of insulin to manage diabetes, they won't qualify. Talked about the diabetic weight column, and then the applicants with diabetes and high blood pressure would require a phone interview. So, next slide. Okay, narcotic pain medications. Narcotic pain medications, there's a number of companies that have the same guideline with their MedSup, underwriting their MedSup business. If a client is on narcotic pain medications for the control and management of pain issues, we will not approve them for coverage. Generally, we require them to be off the narcotic pain medications if they're able to do so for a year. If that's the case, then we would then we could consider issuing them if they've made full recovery. The reason we have that cutoff with narcotic pain medications is that's very indicative of a pretty severe musculoskeletal issue and or need for pain control. So we we have drawn the line there with no narcotic pain medications. Mild anxiety and depression. People with anxiety and depression, we issue them every day, but if their medication is prescribed by their primary care physician, that's okay. If their medication, and we have a question on our application, if their medication is prescribed by a psychiatrist, they will not qualify for coverage, and that's a 2-year rule. If maybe they had psych meds prescribed 10 years ago, but they don't anymore, then that's fine. If their primary care physician is currently prescribing meds for anxiety, depression, we're okay there as well. It's just the cutoff that we've made with anxiety and depression is psychiatrist. So that's pretty clear cut as well, and we'll go through that again when we look at the application. Pending surgery or treatment. With any insurance, I mean, people with pending surgery, pending treatment, I've got to go back to my doctor for follow-up testing for whatever reason. They are not eligible for coverage, and we would decline those. What we do ask, based on, could be for whatever they have follow-up testing for. Once that testing is completed, the doctor's told them what's the issue, then they would be eligible to apply for coverage. But with pending surgery or treatment, we won't issue them. And I think you guys are probably very much aware that that's a pretty generic rule as well. In those situations, though, we would need a currently dated application to reconsider, and we would need updates on whatever that testing was. But that's pretty standard as well. Next slide. Okay, submitting apps to the home office. Actually, we've got a number of different ways to you can submit applications. We do have an e-app that's available for use. So a lot of agents, I think we're probably at the 25 or 30%. To throw out some numbers for you, of all of our MedSup business comes in on an e-app. If the app is upload or faxed, not mail, obviously we also accept faxes. Always include the express issue cover sheet to identify the type of coverage and so on and so forth. With that, make sure it gets to the right area. So obviously paper apps, faxed apps, e-apps. An e-app we came out with just over a year ago, and utilization has been steadily increasing as more people get used to that e-app. It's really a pretty slick tool. And one of the things, shout out for the e-app is sometimes it's easy to miss a question or check a box on the application, but with that e-app, it takes you step by step through the application. So you get through that, and there's some built-in reminders on different questions before you're allowed to submit it. So use of the e-app is kind of a big deal because it gets here. It's going to be in good order when it gets here, and one of the things, the other kind of the bonus things with the e-app is that we have that program now where that e-app automatically uploads to our administrative system, so it really kind of bypasses the keying area, and then it's set to the appropriate team for processing. So it's kind of it's a slick way to get the business work. So okay, next slide.
Dave, are you wanting to move through a sample application at this time?
Yeah, that's great. Yep.
Perfect.
Yep. Okay, so here's our application for Pennsylvania. You can see here. This, the first page here, we'll go through some of this. Outlines Medicare Part A I mentioned was hospital. Medicare Part B is a physician. Tells you what we'll pay, what we won't pay on that. And one other thing to mention, with Medicare Supplement, although these plans are administered at the state level for some of the different rules they adopt, our Medicare Supplement plans, all Medicare Supplement plans are identical. Okay, regardless of who sells them. standardized benefits mandated by the government. So our Plan F looks exactly like Aetna's, looks exact same benefits as Cigna, as Blue Cross's, as everybody. Everybody across the industry. There's no really bells and whistles that you're accustomed to on life products or long-term care products that kind of differentiate one company from another. Not the case with MedSup at all. Every plan, everyone with everybody that sells it is exactly the same. So what we're doing, we're competing on two things, really. We're competing on price of the plan, and we're competing on service. So that's how the MedSup works. But you'll have to, read some of this stuff. Kind of helps explain what's paid for. This page here talks about premium information disclosures, just the consumer rights there. Next slide. Okay, this kind of outlines, and this is sideways, but it's in the packet. You get to know it. This provides a great summary of benefits. We have plans A, F, G, and N. Okay, now one of the things, Plan F, Plan A is kind of like the Volkswagen. Plan F is the Cadillac. Okay, probably about 75 or 80% of our business is written as Plan F. Plan G, the only difference between Plan F and Plan G is there's a little bit of a deductible on Plan G, but we've seen a lot of agents recently, and our Plan G rates are very, very competitive right now. But the Plan G carries a small deductible with it, so for people that are in good shape health-wise, have taken a liking to Plan G, and it's becoming more popular than it was. So that's an option. Look at the two rates. Somebody that is in really good shape, I think it's like a $300 deductible, but with Plan G. But if they're not planning on going to the doctor, the savings from Plan F or Plan G over Plan F easily offsets that deductible on an annual basis. So take a look at that. We also offer Plan N, but this kind of gives a summary of what the different plans will pay for. Okay, next slide. Okay, so just more rights that we talk about. If we're replacing another MedSup policy, there is a replacement form that needs to be submitted. Some more information on benefits that what Medicare will pay, what Plan A pays, what you would pay. Just a lot of information here. The same information here for Medicare, what Medicare Plan B pays, and then we kind of compare what here's Plan F and what Plan G would pay as they go through all this. So this is a great resource of information. Helps you explain what will happen to your customers. Here's a Plan N, kind of a Plan N summary on the same basis. So you can kind of compare the plans A, F, G, and N. You'll see that F is the Cadillac. G is very close to Plan F. The only difference there is the small deductible. Okay, and that's an annual deductible. So here's an agent checklist for completing the application. Goes through different things that we'll need. Obviously the application, the agent certification, how to calculate premium, the express cover sheet, the HIPAA form. Need that because we're getting MIB, prescription drug, and a PHI on the underwritten business. Now if you're applying for an open enrollment case, then you don't need, remember that initial open enrollment at age 65 or within 6 months of their Part B eligibility date. We're not underwriting those. They don't answer health questions, so then you don't need the HIPAA form. I mentioned the replacement, so we'll need that signed. And then it gets down into how to calculate the premium, the zip code. They're zip code rated, what plan you want, tobacco, non-tobacco. The tobacco question for MedSup is any use of tobacco or any nicotine delivery products or products in the last 12 months. So that's that. Find the age and gender, and then calculate the premium. So there is a $25 application fee at this time that's on the application. That's a one-time fee. Okay, next slide. Okay, so this runs through some examples on how to calculate the premium, and then we come to the height-weight chart. And as I talked about earlier, you can see to the far right the diabetes maximum chart, or maximum weight. So as I said earlier, you know, the 6 foot, you can see how generous this chart is. The 6 foot goes from 123 to 294, and then the Tier 1 and Tier 2 ratings, okay, and actually, let me correct myself. Actually, we have a couple weight charts. Some charts, this is one that's approved a Tier 1 and a Tier 2. Okay, so the standard chart in this, not all states have approved this. So we've got two charts. I stand corrected on that. But we have a 6 foot standard goes from 123 to 294. A 10% additional premium will go from 295 to 299. The Tier 2 goes from 300 to 304, and you can see there. But if you're a diabetic, you have to come in at 229. Reason that we have this chart is a number of competitors in the market have adopted and utilizing this. We want to prevent anti-selection, so we've got this same chart in states that will approve this. Not all states have approved this. It's important to note here on the underweight side too. If you're 6 foot, if you were between 118 and 122, then you'd have a 10% bump to the premium. But if you're below 118, you would not qualify. To give you an idea how often the one or two, the Tier 1 or 2 weight classes are used, you know, it's probably 3 or 4 times a year. We just don't see people that fit in those smaller categories. But again, this was done to eliminate adverse selection on our side by not having these additional tier ratings in here. So next slide. Okay, so I'll stop. I want to stop here for 1 second. In the admin guide, you'll have 2 height weight charts. Pennsylvania obviously approved the Tier 1 and 2 tier rating weight chart. At the top of the other height and weight chart, there's a list of states at the very top of that list that is just a standard height weight chart without the Tier 1 and 2 ratings. So it is, just look at the top of the other weight chart, and that's the weight chart that would be used in those states. The only difference to the charts, though, is the Tier 1 and Tier 2 bumps, 10 and 20% bumps in premium. Okay, so here's our application. Nice thing about the application, if you walk into a household, you're going to write husband and wife, you can do it on one app, which is a big deal. So I'm just going to run down quickly through here and kind of let you know what needs to be filled out. So obviously question 1, 2, city, state address, the zip, that's big. A spot for mailing address if different than the resident address, and then city, state, zip. The phone number. Okay, so here's where you'd put the phone number in, the best time to call. Again, if there's a phone interview, the vendor will try to call them at the time listed here in question 9. Their current age is age 64. So you can see right now this person's in their open enrollment period. Here's their date of birth. They are male. A social security number is question 12. The question 13 is the Medicare insurance card number. This is very important here. I want to talk about 13 for just a second. This number is required, and it's entered into our system because when claims come in, this Medicare, the HIC number is what they call it, the Medicare insurance card number. The HIC number is transferred to our claim system because all these claims are paid electronically. Okay, so the doctor, physician, hospital, whoever submits an electronic claim to Transamerica. Our claims department uses this HIC number as the identifier for that claim or for this person, and then the claim is paid automatically electronically. Okay, it's run through some system. They have pre-approved, or I'm not sure exactly how it works, but I know it's done electronically. So, and it's done electronically off that number in line 13. So, make sure you get that. If that's not on the application, I can guarantee that we won't be able to process it because we need that number before we can approve it. So, occupation on line 14, email address, and then secondary addresses down below. So, next slide. Next slide is where you will list in question 1 of section B is where you will list your whatever plan you're going to sell to the applicant, and you can see here that they've requested Plan G. Okay, again, we sell plans A, F, G, and N. So it's one of those 4, and this applicant has selected Plan G. A requested effective date is 9/1. Okay, so September 1st. Mail policy question. This question 4 is required. Have you ever been declined or denied reinstatement for MedSup? If yes, when and why? We do occasionally see yes answers to there with the information, but 99% of the time that's no. In section C here, we've a little bit of information about it helps walk through the premium calculation process. There's a line there that includes a one-time policy fee, and then the mode of payment is also in question 4. Okay, so moving to section D, have you received a copy of the Guide to Health Insurance for People with Medicare and the outline of coverage? One of the requirements for MedSup is you have to leave that information with people. And so if that question is unanswered or if it's marked no, we can't approve a case. That's got to be marked yes. So be sure to leave that with your clients so that they're able to read the information that they're supposed to get. Question 2 is eligible for Medicare due to disability. If they are, then you would check yes. Otherwise, check no. And if yes, are you disabled due to end-stage renal disease? There are certain states that have mandated coverage around people for end-stage renal disease. Some of them limit them to certain plans. One example, I believe, I'm going from memory here, but it's in New Jersey. They have said if you're disabled due to end-stage renal disease, you can only have Plan C. So in New Jersey, we also offer a Plan C. It's one of the few states we have that plan. But that's why we have that question there. Okay, so now we get into questions D3 and 4. Very important questions. These need to be filled out or we can't issue a policy. What is the effective date of their Medicare Part A coverage? It's 9/1, okay? Are you covered on Medicare Part B? Yes, that's 9/1. Okay, so now we know those dates, 9/1 and 9/1, also line up with the requested effective date of 9/1. Okay, if it can, the example on the requested effective date has to be equal or greater to the effective dates of Medicare Part A and B. Okay, so if, for example, the requested effective date was 8/1, we couldn't issue the policy with an 8/1 date. It's got to be equal to the or greater than the date of 9/1. Okay, so here's a question on number 5. Are you applying during guaranteed issue or open enrollment period? If that answer is yes, today some of those applications are being processed right in our new business team. Otherwise, if that answer is no, then it's sent to the underwriting team. Remember, if you're in an open enrollment period, that initial period around age 65, you're within 6 months of your Part B date. So in other words, this person had Part B effective 9/1. They could wait until March or February 29th or 28th of 2017 to get coverage and not have to answer any health questions, right? Okay, because they have that 6-month period. This person is going to get coverage right away. Okay, they're effective for A and B 9/1. They're going to get a 9/1 effective date. So if question 5, this helps direct it to the appropriate team. If they're in their initial open enrollment, it'll stay in our new business team. and they'll process that. Otherwise, it'll come to the underwriting team. Okay. Okay, so in Section E, there's a few more questions about, to the best of your knowledge, did you turn age 65 in the last 6 months? Yes, yes. One thing about, then in question 3, we get to get into Medicaid. We spell those rules out, read those in the admin guide, but just a good guideline overall rule is if you have Medicaid, you cannot have a Medicare supplement. Okay, it's one or the other. So if you have Medicaid, you can't have a Med Supp. If you're coming off of Medicaid, you no longer have it or no longer qualify for it, and you want a Med Supp, then we can consider you. But if you can't have both of them at the same time, and that's a regulation rule that everybody in the Med Supp business, again, not just with Transamerica, all companies marketing Med Supp, you can't have Medicaid and Med Supp at the same time. So keep that in mind, but we don't run across that as an issue very often. Okay, next slide, Kristen. Okay, so top of page 3, one of the things we haven't talked much about, I guess I mentioned it earlier, was Medicare Advantage. Medicare Advantage is kind of a competitor to Med Supp, if you will. Medicare Advantage says if you get a Medicare Advantage plan, some of you already may know this, but that's kind of the simplest way to describe it is kind of an HMO for Med Supp people, where you have to use certain hospitals, certain physicians, certain clinics, et cetera, et cetera. You can't use, if you have a Medicare Advantage and you take a trip to Florida and you want to use your Medicare Advantage, not going to work, because you've got to use it here where you are in Iowa or Nebraska or wherever. If you have a Medicare supplement and you want to take a trip, it's good around the country. Okay, so keep that in mind as a selling point to people that you may run across. But if you do have Medicare Advantage and you're leaving Medicare Advantage and coming to our country, Transamerica, you would list that Medicare Advantage coverage in section or under question 4, and there's a start and an end date. Okay, those are very, very important, and you'll see why in our administrative guide, because there's a lot of rules with Med Supp, and if you join a Medicare Advantage plan and within the first year of joining want to leave that plan, you can still get some guaranteed issue rights with another company's Med Supp. If you're in it more than a year, then that guaranteed issue right is off. So familiarize yourself with the Med Supp rules. We go into great detail explaining them, and it's pretty easy to understand once you just read through it. But we do need the Medicare Advantage coverage here as to start and end date. Okay, so this is kind of a Medicare Advantage section. This question 4. You can see here. There's also questions in F here. Did you drop a Med Supp or Med Select plan to enroll in this Medicare plan? There's rules around if you had a Med Supp first and then went to Medicare Advantage and want to come back to Med Supp. So make sure you make sure that you still read that section and understand it. In G, is your former Med Supp or Med Select still available? There's some rules that say if you have a Med Select or a Med Supp and you want to go to Medicare Advantage and then you want to come back to Med Supp, you've got to go back to the previous carrier if they're still selling that plan in your state. So that's probably more detail than needed here, but familiarize yourself with the Medicare Advantage rules. Under question 5, here's where you'll list, and if you're moving from a Med Supp to a Med Supp, if you're moving from an Aetna policy to Transamerica, this is where you fill in the Aetna policy. You'd put Aetna here, and then obviously their policy number, their plan, their issue date, etc. And then here down below in 5B, do you intend to replace that policy? And that would be a yes. And then obviously the termination date. And if yes, have you received the replacement notice? Replacement notice is also a required form. So anytime you're replacing a Med Supp from another Med Supp, we've got to have that replacement form signed. And then in question 6, have you had any coverage under any other insurance in the last 63 days? So if they have had continuous coverage, that's a good thing. for them and for everybody, but then that would be checked yes. Okay, let me see here. If for example, if the bottom part of page 3 here is this area of the form is used if you are coming off your group, if you don't have a MedSup, your other MedSup coverage would go in question 5. If you're coming off group insurance, okay, the bottom of page 3 is where you'd list your group health plan, the start and end date. Your reason for terminating is that due to retirement, and the termination date's 9/1. That date lines up with the effective dates of your Medicare Part A and B that we saw on the previous page, and also lines up with the requested effective date. So this is where you'd put the group health information. So the top of page 3 is this page 3 is kind of an important thing because there's so many rules that go along with this. The top of page 3 is where you'd put your Medicare Advantage information, if they have Medicare Advantage. The middle of page 3 is where you'd put your Medicare supplement coverage, other Medicare supplement coverage if they're moving from company to company. And the bottom of page 3 is where you'd put your group insurance for those people that are retiring off of, they're retiring from their jobs and they had group coverage, and here's where you put it. So that's pretty self-explanatory. But just remember, top of the page is Medicare Advantage, middle of the page is MedSup, bottom of the page is group coverage. Okay, so on page 4, now we're getting into the health questions. We ask for other policies that the agent has enforced with them. To be very honest, that's not filled out very often. And but if there are policies there, please list them. Okay, so now we're into section F, and I've go through this in fairly good detail. But section F talks about that's our health questions that need to be answered for those people that are going to be underwritten. Okay, so question 1 is we ask for the medications that they've been prescribed within the past 12 months. So if they're taking high blood pressure meds, if they're taking meds for glaucoma or whatever it might be, cholesterol, please list them here and with the date and why they're taking them. Why they're taking them is important too when you get to some of the heart meds. But please list them there. In Pennsylvania, the height and weight question is back here in section F. In some of the other states, it's on page 1, right by the tobacco question. But again, different states have different rules for where questions can be. So in Pennsylvania, it's back here. Obviously we need question 2 filled out, and then we get back into the same with the tobacco question. In some states, the tobacco question is on page 1. The reason for that is check the admin guide. More rules. Some states will allow you to charge tobacco rates when you're in your initial open enrollment period at age 65. Others don't. So Pennsylvania is one of those states that says you can't ask for height and weight. You can't ask for tobacco because they consider that a health question. Put that in section F. So, if you're applying for open enrollment, you don't have to answer those questions because open enrollment doesn't complete section F. And you can see here in section F, complete this section only if you are not applying during open enrollment or in a guaranteed issue period. So tobacco and height and weight is back in section F for Pennsylvania. So then we get into the diabetes right off the bat. We talk about the organ transplant. Many of these are very straightforward questions. One thing I do want to point out is all of our applications, the first set of questions you can see under number 5 here is have you ever had, or have you ever. So the organ transplant, diagnosed or Alzheimer's, dementia, mental incapacity, etc. And this is have you ever again, remember. Been advised to receive treatment for Lou Gehrig's, Huntington's, any other terminal conditions, been treated with systemic lupus, osteoporosis with fractures. Again, osteoporosis is okay. Osteoporosis with fractures, not okay. Kidney disease or failure requiring dialysis. So if they have a kidney disease, we do write some of those, but if they have kidney disease or a history of failure requiring dialysis, they're not, okay? Used insulin to treat or control diabetes. And then have you ever used insulin? So that's pretty straightforward. had any type of diabetes with complications, retinopathy, neuropathy, nephropathy, peripheral vascular heart disease, stroke, transient TIAs, high blood pressure, or skin ulcers. Those, pretty straightforward. And remember, we will consider people with diabetes, controlled, oral meds or diet, and high blood pressure, but their blood pressure's got to be below 145/84, and their A1C's got to be below 8. Remember, we talked about that earlier. So keep that in mind for people that you run into with diabetes and high blood pressure. No changes in medication with the last 2 years. A1C under 8, blood pressure under 145/84. Obviously, if any of those readings are above, or there have been changes in meds in the last 2 years, they would not qualify. The diabetic coma, again, very straightforward. Cirrhosis, emphysema, COPD, or chronic pulmonary. And again, these are have you ever questions. Age question is the last one there. Okay, next slide. How are we doing on time, Kristen?
We're good. We are running up probably closer toward the end, so I would say maybe.
Okay. I'll try to go faster here. J is the last question of the have you ever had, okay, and that is neurological disease, myasthenia gravis, sclerosis, or Parkinson's. Have you ever? Okay, so our health questions are separated into 2 sections. First section is have you ever had. You can see here under question 6, this is within the last 2 years. Okay, so keep that in mind. The have you ever had, and then they all go to 2-year questions. It's the same in every state. Okay, all of our health questions. Okay, so 2 years to currently using a wheelchair, reside in a nursing home, etc. 3 or more times in a hospital, or currently admitted to a hospital. Diagnosed, treated, or for cancer. Okay, so I want to talk about this for just a second. Cancer treatment. Somebody's had breast cancer or whatever. They had it 10 years ago. Okay, they had 2 years of chemo, and they're done. They're done with treatment. No treatment within 2 years. They're still eligible. Okay, it's for those people with recently diagnosed cancer, or people that are currently undergoing chemo or radiation, or using some sort of oral drugs or whatever, that would not. Okay, so keep that in mind. We do write cancer patients or with full recovery, but it can't be with no treatment within the last 2 years. Treatment for alcohol, drug abuse, mental or nervous, requiring psychiatric care. We talked about this a little bit earlier. We write these people every day. On the psychiatric care is the cutoff on the mental or nervous disorder. If it's meds, if they're seeing a doctor and their primary care physicians prescribing medication, we issue them every day. We also decline some that have that see a psychiatrist. So we ask, that's a question on our phone interview. Diagnosed for treatment, heart attacks, coronary or carotid artery, congestive heart failure, enlarged heart, stroke, TIAs, or heart rhythm disorders. Talk about this for just a second. Heart rhythm disorders, we see a lot of those. It's either AFib or, different types of rhythm disorders. If somebody has a rhythm disorder or one of these other things, or they've had a heart attack, or they've had a stent insertion, or they've had a bypass for heart disease, we can write them if it's been more than 2 years ago, okay, and they've had a full recovery. A lot of those people, in fact, nearly all of them are on some sort of maintenance medication. That's fine if it's over 2 years. Now, for heart rhythm disorders, we'll use atrial fibrillation, okay? If they have atrial fibrillation, they're on a maintenance, and it was more than 2 years ago, and they're on a maintenance medication, that's okay. The one thing that we're interested in is, have they had an episode of AFib within the last 2 years? If they have, that's a problem. We got to decline it. If they're on the maintenance medication, they haven't had another instance of atrial fibrillation for the last 4 or 5 years, then we're good to go, because they're on the medication, maintenance meds, but they haven't had an actual episode of AFib, then we're okay. Same thing with diagnosed, received treatment for degenerative bone disease, crippling disabling, rheumatoid arthritis, or advised to have joint replacement. Rheumatoid arthritis, crippling, disabling arthritis is a decline. Okay, if somebody has arthritis in a knee, okay, and they're on a meloxicam or something like that, they're taking treatment. We issue those people every day, okay? Now, if they have arthritis in their neck and their back and their hip and their knee and their ankle and their fingers and their hands, then we don't write them, okay? Multiple joint arthritis, not so good. If they have arthritis in a knee or a wrist or whatever it might be, then they do qualify. Difference there is joint involvement, and are they able to function as on a day-to-day basis with some medication. Again, this is where narcotic pain medication, talked about that early on. Any narcotic pain medications, they do not qualify. H is medical test treatment not performed. We talked about that. That would be declined. If surgery may be required, if you've been told you're going to have surgery in the next 12 months, use oxygen equipment, respirator, or catheter, obviously would not be eligible. So then we get down into the Part G is a billing section. This is how we upload this information in our system, so we can draw money from their account to pay for the premium. Okay, again, Section H is just to read this information so they understand what a MedSup is, how it's going to work. Talks about, I believe, their free look on here, and this is where they would sign, and you would sign, and sign and date the policy. So this is an important page too. We would need these signatures. Supplemental application. If there's not enough room on the app, or there's something you want to tell the underwriter, or if there's more medications, or whatever it might be, this is where we use. We have this available for use for you and your client. So next page. Addendum, a pre-existing condition limitation. A while back, we instituted what we call a 6-month pre-ex. So the 6-month pre-existing applies if you're coming to us for a Medicare supplement and you're coming without credible coverage. So let me give a few examples. If you have group coverage and you're moving at age 65, you're moving to a Medicare supplement, you are coming from credible coverage, so the termination date of your group coverage and the effective date of our coverage would match up, and there would be continuous coverage. So this 6-month pre-ex would not apply. If you're moving from a MedSup to a MedSup, it would not apply because you're coming from credible coverage. So keep that in mind. This is for uninsured people, really, that are not moving from pre-existing coverage, and then there's a 6-month hold on paying for pre-existing health conditions. So, and I believe that's also a form that requires a signature. Next slide. Yeah, this just talks more about the pre-existing. Please read all that. It's pretty straightforward, but if they're moving from credible coverage to us, it doesn't apply at all. And then here's the signature pages for the pre-ex form. The conditional receipt, the typical MIB disclosure that you're very accustomed to. So some more rules on open enrollment and guaranteed issue worksheet. List some of those rules, and all those rules can be found in our administrative guide. Our HIPAA release, very standard that you're familiar with there. Here's our replacement form. This would need to be filled out. Page 2 of this form is where we would sign, and you'd just check one of these boxes as to which situation it is. Box number 2 is checked quite often, no change in benefits but lower premiums on the underwritten cases. So anyway, there's the signatures that are required. Same replacement form. Agent certification form, here we ask that you check the box, and I believe this is a required form by our new business team. but check whatever plan you're applying for here, and then it confirms that you're licensed and approved and all that kind of good stuff, and lists some of your signature and your agent identification number. So, and then here's the cover sheet on the application. So, I got a little bit worried there. I apologize, but I felt it was pretty good information. Oh, here's just kind of a summary that you've selected plan and whatever plan and what rate the policy carries, what premium. Kristen, do we have any questions?
We do. Let's see here. Lots of good questions coming in. I'm going to just move on some of these leave behind forms. We'll leave it on this slide and we'll ask some of the questions. One of them coming in, if a client has a Medicare Advantage plan, do they have to wait for open enrollment to purchase a Medicare supplement?
Great question. The answer is no. But here's the rules. In our admin guide, again, and I keep referring you to that, we have a specific page laid out, and it lists the time frames of the annual election period, which is October 15th to December 7th. And then there's an MADP that runs from the 1st of January to I believe it's Valentine's Day. If you're within either of those two time frames, okay, October 15th to December 7th, and that's app date, or January 1st to Valentine's Day, we will accept a note, a handwritten note that it can be as short and as simple as, I intend to terminate my Medicare Advantage coverage, and then list the effective date. Most of the business we see during the AEP, October 15th to December 7th, they always terminate at the end of the year, okay? And then when we issue a policy, our MedSup starts January 1st of the following year. If we're not in those two time frames, the AEP time frame of October 15th or first of the year to Valentine's Day, if we're outside of that, if we're sometime in June, or if you wrote one now, then we would need a release from the Medicare Advantage carrier, and it would have to come from their official document or on their letterhead saying that so-and-so will be out, we'll let this person out of Medicare Advantage on such and such a date. Reason for that rule, you're probably saying why. Here's why. Is because with Medicare, our effective date, they've got Medicare Advantage now. They're going to come to us as a MedSup, okay? They may want to come to us effective August 1st. But what if the Medicare Advantage carrier doesn't let them out of that Medicare Advantage plan until October 1st? Now we've got an overlap in coverage, and our regulations say that we're regulated. Everybody's checked on this. Is our coverage cannot overlap with Medicare Advantage. So our effective date has to line up with the effective date that they're out of that Medicare Advantage coverage. So if they're out July 31st, good to go. We'll go 8/1 on our policy and we're set. But if they want an 8/1 date and that Medicare Advantage carrier won't let them out till 10/1, now we have a problem because we're obligated to issue our policy to line up with the effective date of Medicare Advantage. And in that example, we just overinsured them for 2 months. Okay. Outside the AEP dates for the NADP dates, you need that on the so it'll be the other time or MADP stick a handwritten I intend to pay my page such as they say that we're good to go.
Dave, we've got some static on your line. Hopefully we're not losing you on the connection. I do have some questions coming in for diabetes. If a diabetic applies at age 64 and a half, if they're insulin dependent, would they be declined?
No, they wouldn't be, because we can't ask them if they're insulin dependent. They don't have to answer health questions during that time frame.
All right.
We're not allowed to ask questions. That's why I say everybody's got a free pass.
Let's see here. For the diabetic weight chart, those are for non-insulin controlled diabetes, correct?
Correct. Yep.
And let's see here. All right. Okay, how about this question? Let's see. Are height and weight required during open enrollment?
No.
And do we have a multiple policy discount or like a household discount?
I don't know who asked that question, but that is a very good one, and I did not cover that for a very specific reason. We do not today. We have not had one since we started selling in 2012, but our product area, our actuarial area, our sales area, our underwriting area, we all know that we're one of the companies that does not, one of the few companies that does not have a household discount rate. And I can tell you that it is being worked on now. I don't know if it's going to be approved. I don't know. I don't know if it'll be approved, period. I should, you know, I know they're looking at it now, and they would like to get one, but we do not have one today.
Let's see here. Can someone who is currently with a MedSup with another carrier replace it with us, Transamerica, as guarantee issue? How about Med Advantage and MedSup? I think you may have touched on that, some of that. Is there anything you'd care to add on that?
Typically, again, depending on if they joined, that's a very, there's a lot of turns that question could take. Did they get a Medicare Advantage when they first turned age 65? If they did, you go one way. If they had a MedSup when they first turned age 65, it goes a different way. So it's hard to answer that question without more detail. But typically, there is an opportunity, depending on the circumstances, if you're in a Medicare Advantage for less than 1 year, there are some opportunities to move back as a guaranteed issue. And again, depending on what company you went with when you first had, and if they're still selling that plan, et cetera, et cetera. So I just can't answer that question the way it's asked. But whoever has that question, give me a call. My number for all is 319-355-6777, and with a few more details, I can answer that question.
Awesome. We are definitely over our time limit, so we'll just we'll come with one more question here. Dave, can you talk about someone with cancer? Are they qualified to apply within the open enrollment period?
Yes, they are, because we would never know because we can't ask health questions.
Gotcha. We had tons of questions come in, and if we missed your question, please don't worry. We will reach out to you directly here after this session. Is there anything else you'd like to add, Dave, before we wrap up for the day?
No, thanks for the opportunity to visit with you today. I've enjoyed this. I hope you have. I tried to give you a pretty good idea of what, go through this and tell you how we do business and how it works and all that. And again, if you have questions, don't hesitate to give me a call. I'll be glad to answer them. And Kristen, if you need help with the questions that you've got submitted that we didn't get answered, give me a holler.
You bet. I'll do so. Thank you, everyone, for joining us today. We are going to have this session recorded and posted to the TAANI site as quickly as we can. So those of you that maybe weren't able to stay for the full time or maybe join late and want to use it for training purposes, it will be there for you. Thanks again, Dave, for taking time out of your busy schedule. We appreciate all you do for us, and I hope everyone has a great rest of their week.
Thank you.